Good afternoon and welcome to the Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we have Dr. Melanie Brunt, who is Chief of Endocrinology with the Alliance. Welcome. Thank you for coming. Today we are going to talk about thyroid. This is a subject that personally I don't know that much about, so that's why we do the show. The way to learn. So welcome and thank you for joining us.
Nice to be here.
Thank you. We have all heard, and we pretty much all know that the thyroid is located somewhere here.
Right.
Well, that's good. I passed that one. And thyroid is a gland.
Right.
Hence endocrinology.
Right. Endocrinology is the study of the glands of the body, and glands are parts of the body that secrete or release into the bloodstream some kind of hormone or biologically active substance. So we traditionally think of hormones as reproductive hormones, estrogen and testosterone, but hormone is actually a general word for all of the substances produced by the various endocrine glands of the body. So that's the pancreas, the thyroid, the ovaries, the testes, the adrenal glands, pituitary gland, which is in the brain. So those are all glands that are kind of within my specialty of endocrinology. And just to, do you want to move over to the...
Sure.
Yeah.
We're going to try this, folks. Hold on.
Right.
There we are.
What you see here, a little hard to see from this far away, and also I have trouble pointing without, okay, this is the thyroid gland, as Roberta indicated, right here in the neck. Very superficial, right under the skin and muscles of the neck, and wrapped around the windpipe, which is the tube that goes to our lungs. So other endocrine glands, we have the pancreas, we have the adrenal glands, there's one on top of each kidney. We have testes and ovaries. Those are kind of the main ones. And then the pituitary gland, which is at the base of the brain, controls all of those hormones.
Oh.
All of those glands.
All of those glands.
Yeah.
So let's go back.
Yeah.
So the, we didn't go back.
Did we hit preview? Do you want me to?
Try it. One, and then preview. It likes
There
you
we go.
better.
Yeah. Shorter fingernails.
Before we went on the show, Dr. Brunt was telling me that insulin is a hormone, which I have never heard it called a hormone, and of course the pancreas then would produce the insulin.
Insulin, right.
And the ovaries would produce the estrogen,
progesterone, and some testosterone. Yeah.
And the pituitary gland, does it just control everything, or does it also
It releases a bunch of hormones called releasing factors that control the other endocrine organs of the body.
So this is sort of the main
It's kind of
control
in charge
channel,
of all the other glands, right?
Okay. And then the adrenals, do they secrete a hormone?
They produce something called cortisol.
And also, we know what that is.
And also what we would think of the lay term as adrenaline hormones. So the adrenal glands are kind of your fight or flight glands. Like if you're under a situation of severe physical or even emotional stress, those hormones from the adrenal glands are pumped out. So if you have a major injury or a major accident, you need your adrenal glands because they have to pump out a lot of those extra hormones, adrenaline hormones and cortisol, for you to be able to survive and heal from that injury or accident. So, So
there's been a lot of talk about cortisol.
Well, there's unfortunately a lot of noise on the internet that is not very accurate, and there's a lot of concepts that various websites talk about in relation to the adrenal and the thyroid that really don't. That aren't supported by science, really. So there's this, for the adrenal glands, there's always talk about something called adrenal fatigue, which is a disease that doesn't actually exist. So
this is why we do the show.
And for the thyroid, they often say, well, your doctor has to check all of these blood tests, not just the one screening blood test. And even if your blood tests are normal, your doctor is doing you a disservice if they're not measuring all these 6 other blood tests to really prove that your thyroid is normal. And all of that is kind of really disinformation, I would say. So
this is good to know. So one thing I know about the thyroid, which is very limited knowledge, but we know that there's hypo, which is underactive, and hyper, which is over.
right.
And in my learning, the hypo has been associated with weight gain, and the fact that if you have
A weight problem.
a
it's
weight
thyroid.
problem.
Well, unfortunately, that's another popular concept that isn't supported by a lot of data. Either hypo or hyperthyroidism can be associated with small fluctuations in weight, but even though lots of people come to my office wishing and wanting to blame their weight problem on their thyroid, it's actually very unlikely to be from the thyroid.
Well, unbelievable, because I have been thinking that and believing that for many
Yeah,
years.
as have many people. I want to back up just a little bit because it's helpful to think of thyroid problems as kind of structural problems, meaning there's an anatomic or physical problem in the thyroid, usually a lump or a nodule. And then there's functional problems, which is when there's either too much or too little thyroid hormone, which is what you're talking about, hypo and hyper.
Okay.
So a lot of people have nodules or lumps in their thyroid, but that actually doesn't tell us anything about thyroid function. In other words, you can have a big lumpy thyroid, it can be working perfectly normally.
Really?
You can have a big lumpy thyroid, it can be underactive. You can have a big lumpy thyroid, it can be overactive. So having a physical...
A big lump is not a major cause for concern, because normally we would think like
Well, so
tumor.
thyroid nodules or lumps can be cancerous, but only 5% of them are cancerous. So
Wow.
most of the time, lumpy thyroids are not serious. And most of the time, they're not associated with a functional problem, either too much or too little thyroid. So, and in terms of function, hypo meaning not enough thyroid hormone, or hyper meaning too much thyroid hormone, if you think of the thyroid, it's kind of like the engine idle of the body. So it kind of runs the engine of the body.
Okay.
So if your engine idle is set too low, the car will kind of sputter
Conk
and
out.
conk out, right? So in other words, the metabolism is getting really slow and isn't working properly. If your engine idle is set too high, then the car will race, right? So thyroid hormone kind of runs the engine of the body. So unlike hormones, the traditional concept of hormones is it has to do with reproduction and sex drive and all these things. Thyroid hormone really is running the body's metabolism. It doesn't really have anything to do with the sex hormones.
So the metabolism,
Yeah.
which is what burns the calories.
Well, so then you might infer from that, oh great, if there's a problem with my thyroid then and it's slowing down my metabolism, that's why I've gained weight. But unfortunately, it just doesn't work that
so.
nicely, unfortunately. So I mean, in terms of symptoms, if you think of, let's say, your engine idle is too slow or low, like hypothyroidism, people can be very tired, they can be achy and sluggish, they can have kind of a brain fog. If severe hypothyroidism, when your thyroid is really, really low, people can get kind of puffy and swollen.
Wow.
And so I don't know if you remember the term cretinism or cretins. It's a very old term, but
Yeah.
in our generation you might remember
But
that.
I've been kicking around here for a while.
Yeah, me too. So that's actually a term for severe hypothyroidism at birth. So in other words, a baby that's born with very, very low thyroid. Nowadays, all babies are screened at birth for thyroid problems. So you don't really see that anymore, because if the rare condition where a baby is born without a functioning thyroid, it's detected at birth.
So and it can be rectified?
Yes, with thyroid hormone replacement. So
For the rest of the baby, for the rest of the life. So the entire life.
Yeah.
Wow. I didn't know that.
Yeah. It's
so
unusual.
what if you have a hyper then?
Okay, so
are you
then
gonna feel like peppy and zippy and full of energy?
Well, unfortunately, you can still get tired because your body's in overdrive all the time. I mean, it's kind of like The heart rate is really fast. The heart muscle can actually get really taxed and have trouble pumping properly.
Oh, that's not good.
Yeah, so irregular or fast heart rate, shaky, sweaty, dizzy, hyper, insomnia. Those are the symptoms that can happen from severely overactive thyroids. Part of the problem here, though, is a lot of times when we find out that someone has a thyroid problem, it's just a little low or a little high. And then those kinds of, a little bit off in one direction or the other, usually not associated with a lot of symptoms.
And so would it be treated if it were a little low or a little high?
It depends on how little. And it depends on the age group, and it depends on the situation. I mean, in elderly people, we would be less inclined to treat a slightly low thyroid, maybe more inclined to treat a slightly high thyroid because of the risk of irregular heartbeat. In younger people, women especially, we always treat a slightly low thyroid in a woman who's trying to get pregnant or in that age group where she might get pregnant. So it really depends on the age group.
There's a lot to this.
Yeah.
That's why we have you.
That's right. So,
now, are there different conditions of the thyroid?
sure. There's nodules or lumps I talked about.
Right.
Somebody can just have a big thyroid, like this is kind of a thyroid. This is the inside structure of the neck. This is the trachea or windpipe here, and this is the thyroid kind of where it is, right across the front of the trachea. And this is the Adam's apple here. So the thyroid is kind of right at the base of the neck between here and the Adam's apple. Yeah. So you can have a lumpy thyroid, you can have an underactive thyroid, you can have an overactive thyroid, there's all kinds of disorders of the thyroid. There's even a lymphoma, which is a kind of cancer of the blood cells that primarily affects the thyroid.
Oh.
But that's very rare.
That's rare.
Yeah.
Well.
And I was mentioning before that nodules or lumps, which is one of these has a lump. Well, my lumpy thyroid doesn't seem to be here.
Can you feel them on yourself? Or
no,
do you detect by?
Well, so sometimes yes, you can see or feel a lump. A lot of times when I see a patient for a lumpy thyroid or a nodule, it's because they had an X-ray for some other reason that turned it up. They might have gone to an emergency room after a car accident and had a CAT scan of the neck. They might have had an ultrasound of their carotid arteries to see if there's any blockage.
So it might be then an incidental finding.
Right, it would be called an incidental finding. They might have a CAT scan of the chest, and they see a lumpy thyroid. So it really varies.
So I want to just say, so in order to determine whether or how a thyroid is functioning, it's a blood test.
It's a blood test, right?
A blood test. So, and that can be run. Is that something that when blood is taken, like say for your physical, is that something the doctor orders as a routine? Well,
often they order it, but routine screening, like yearly, is not necessarily indicated for everybody.
Okay.
If you have a family history or we were talking earlier about autoimmune disorders.
Yes, let's talk about that.
Yeah, so there are some conditions of the thyroid that are considered autoimmune, meaning your own immune system is causing the problem. And there are other autoimmune disorders. There's lupus and rheumatoid arthritis and other disorders that are also caused by a kind of overactive immune or hypervigilant immune system. So what happens in the autoimmune thyroid disorders is your immune system, which are the blood cells, produce antibodies against the thyroid. Ordinarily, antibodies fight off infection. So you don't get measles or mumps or whatever. Once you've had one of those conditions, your body will have antibodies to prevent that infection from coming back.
Okay.
So those antibodies will fight off any sign of that infection being introduced to your body. In this case, the antibodies somehow get the message that something that's internal is a bad guy, and they attack it.
Oh.
And that's what an autoimmune disorder is. So
your body's attacking itself.
Yeah,
basically.
kind of. But these particular autoimmune disorders of the thyroid really only target the thyroid. Like lupus can affect almost any organ in the body, but these only...
Through the blood.
Yeah, through these antibodies that are causing damage.
Wow.
So autoimmune thyroid disorders, interestingly, there's really two kind of categories. One causes a low or underactive thyroid by damaging the thyroid. So the antibodies attack the thyroid, it causes scarring and damage, and then the thyroid can't work well and your thyroid gets underactive.
Wow.
But there's also another disease called Graves' disease.
Oh, I've heard of that.
Yeah, named after a Dr. Graves, where the antibodies that are being produced are actually stimulating the thyroid to make more thyroid hormone, and somebody gets very overactive. So those are the shaky, sweaty, fast heartbeat, nervous, anxiety type symptoms that I was talking about usually or often happen with Graves' disease.
And that would be treated. You would treat that to slow it down.
Right.
Right, if they have been diagnosed with this Graves' disease.
Right.
Yeah, wow. So, do we operate on the thyroid ever?
Well, if it's lumpy and you have a biopsy of a nodule or lump and it's suspicious for cancer, yes, the treatment is operation.
And then what do we do? Do we take it out?
Well, so for cancer, usually, and then you go on a replacement pill.
Oh.
But sometimes people have surgery just because they have a really big lumpy thyroid that's starting to, I mentioned before that the thyroid is wrapped around the front of the windpipe, right? Mm-hmm. Well, what if the thyroid gets really big and really scarred and presses on the windpipe? Well, that doesn't happen. Oh. But it can start to cause wheezing or some difficulty breathing when someone lies down. So sometimes we take out really big thyroids if they're causing a problem like that.
So if there's a lump, a big lumpy problem, and it's in the way for whatever reason,
right.
You take out the whole. You don't take out the lump. You take out the whole thyroid because it's not that big, right?
Yeah, it depends on the situation. So this is a normal size thyroid here. So it really depends on how big the thyroid is and how technically feasible the operation is. So generally when a surgeon operates on the thyroid, they take out either the whole thing or half. You see how it has two big pieces and then the connecting piece that's called the isthmus or connecting piece.
Right.
So a surgeon might take out, if there's a nodule only on one side, they might just take out one side and then wait for the final report. Though sometimes if you're having half your thyroid out because there's a biopsy suspicious for cancer, if after the operation it's confirmed to be cancer, they might have to go back and take the other half out. So sometimes they just take the whole thing out depending on the severity of the finding on the biopsy. And then if somebody has a really big, like I've had patients have one really big side of their thyroid and then only that side needs to come out.
And then can they function, or they need to go have some medical?
So if you have the whole thyroid out, you have to go on thyroid hormone replacement, which very common medication called levothyroxine, which is essentially identical to what your own thyroid produces.
Okay.
So you're really replacing the thyroid with something that the body can't tell. The body can't tell the difference between the thyroid replacement pill and its own thyroid.
So it works?
Yeah, so the body is tricked into thinking that your thyroid's working just fine and you can just stay on that medication.
Mm. And that would be for the rest of your life?
If your whole thyroid is removed, yes.
Right. And what if half of it is removed? They have to test it to see how much it's producing?
Right, it depends on the reason that it's removed, but there are certainly people who only have half their thyroid out who don't need thyroid medicine. So they have a slightly higher chance of needing it at some point in their life than if they had their whole thyroid, but oftentimes they don't need it.
So one more question I have is, if you have cancer of the thyroid, and is it usually contained? Self-contained, so once that's removed, do they do chemo, do they do radiation?
So more than 90% of thyroid cancers are cured by removing the thyroid gland.
More than 90%?
Yeah.
More than 90?
Yeah.
Wow.
So it has, for most people who have thyroid cancer, it's if you're going to get cancer, it's a
That's
good
a place to get it?
It's a good cancer to get because it doesn't tend to be life-threatening if it's removed. And Sometimes people need additional treatment after the thyroid is taken out. They're given a pill that contains radioiodine. It's a radiation treatment, but it's not like conventional cancer radiation treatment. You don't lose your hair, you don't feel sick. It's basically one capsule you swallow one time.
Wow.
And that's the treatment.
Wow. That's pretty good.
And occasionally, in the 10% of people who have more trouble with the thyroid cancer, it's spread, then that radioiodine might be used again in different doses over the years to control the cancer. Most people with thyroid cancer live a long time. It doesn't tend to be a very lethal disease. So
So if you do not, say it doesn't run in your family, it's not hereditary.
Right.
I would just think that smoking might, does smoking? No.
There doesn't seem to be a relationship between smoking and thyroid cancer.
So
no.
how does one get thyroid cancer? We don't know.
We don't know. We don't really know how anyone gets any cancer aside from the obvious ones where you know it's from smoking or radiation exposure or something. But in this case, we really don't know.
Interesting.
Yeah.
It's all very interesting. So we've mentioned, is that the only, the treatment, the medicine, what is it?
Levothyroxine.
Levothyroxine, is that pretty much the only medication that's given?
Well, for a low thyroid, yes. Although occasionally people who don't feel well, despite normal blood tests on the levothyroxine, we might add a second medication, which is a different form of thyroid hormone. And then if you have Graves' disease or one of the disorders is causing too much thyroid, you would need a different category of medicine. And what that does is it interferes with the thyroid's ability to produce thyroid hormone, so it lowers the blood levels. Sometimes for an overactive thyroid, people have that radiation treatment I was referring to. You swallow a radioiodine capsule. So radioiodine is interesting because it's very uniquely designed to deliver radiation to the thyroid and only to the thyroid.
Wow.
Because the only part of the body that really uses iodine is the thyroid. And I'm sure you've heard of iodized salt.
Oh,
Do you know why salt is iodized? It's iodized because before, in the olden days, when it wasn't iodized, the middle of the country was called the goiter belt. If there isn't enough iodine in the diet naturally, the thyroid keeps getting bigger because it's looking for the iodine, it's trying to keep up, doesn't have enough iodine to do a good enough job to produce thyroid hormone, so it gets bigger. That's called a goiter, which just means big thyroid. So iodized salt is iodized salt is a public health program. They iodize salt so that people don't have iodine deficiency in this country. And
What
that's
if you have to cut back your salt? Are you in danger then?
No, because there's salt in everything. It's very difficult to get rid of salt in the diet, and so if you eat bread or any kind of commercial, anything you buy that's prepared outside the home,
Has salt.
it has salt, and it probably has
This
iodized
is
salt.
all very interesting. I had no idea we were going to find out all of this information today.
So, and interestingly, in a lot of parts of the world, there are not these iodine supplementation programs. So a lot of parts of Africa, even parts of Europe, they don't have any supplementation program, and there's a lot of iodine deficiency. So in regions of the world where there's still a lot of iodine deficiency, you get more of these big, lumpy thyroids.
Wow.
So in our patient population at Cambridge Health Alliance, have a lot of Brazilians, a lot of Haitians. Many of those have not grown up in an environment where there's iodized salt or any kind of iodine program, and so they get big lumpy thyroids.
Yeah, but what about when they come here and they are then receiving it? It's not
Unfortunately,
enough to
it
catch
doesn't.
up?
No, it doesn't shrink again. The big lumpy thyroid stays. It might be less likely to keep getting bigger, but it doesn't go away.
It doesn't go away.
Yeah.
No.
So.
Wow. Well, what else do you actually do the operation, or is that?
I do biopsies.
You do biopsies.
Yeah, which is basically putting some small needles into the nodule or the lump in the thyroid. It's an office procedure, but I don't do surgeries.
Like an aspiration? You would draw the fluid out and then have that tested?
Right.
Right. So it's not actually physically going in and cutting.
No,
It's
no
just
cutting.
a needle.
Yeah.
Wow. We have we have gotten a little more civilized in medicine. Well, we have a few more minutes, and so we've already sort of alluded to you're a specialist with the Cambridge Health Alliance. And hopefully, believe it or not, I am still finding people out here that do not have a primary health care provider, if you can believe it. And then they just take their chances and end up in the ER, get patched up, and then they go home till the next time. But in order to get a doctor like Dr. Brunt, it would be a referral from your primary.
From your primary doctor, yeah.
Yeah.
And you can go to the challiance.org website, and if you need a primary care doctor,
that's right.
And there's a button to click that says if you need a primary care doctor, it'll give you suggestions. So.
Right. Well, and I'm out here talking about that all the time. We have a doctor finder service, and actually that number is 617-665-1305. So,
and I just want to say, as much as your Prevention Magazine supplement says that you're going to lose stubborn belly fat if you take thyroid medicine, do not believe it.
It's not true.
Damn, huh?
It's not true.
We all want to lose that belly fat. All women of a certain age.
The cortisol, they say, is around the middle.
Yeah. That's just
hogwash.
Yeah, exactly.
It's just a capitalist trick to make us buy some things.
Right,
probably.
some supplement.
Well, we know what that's like. So is there anything else that we have forgotten? We have just maybe one more minute to wrap up. Is there anything else, other information that you think might be useful to our folks? And we covered a lot of ground. And we certainly went into areas I had no idea we were going into. So we've done pretty much covered it all?
I guess ask your doctor if you've had a thyroid test in case you need to be screened for a variety of reasons and haven't been screened.
So there you are. All right. Well, thank you so much for coming on board. We appreciate it. And this has been very educational for me, and I hope for you as well. Thanks so much, Dr. Brunt.
You're welcome.